Hi, my name is Maricela Estepalis, and today I'm going to talk about maintenance intravenous fluids in acutely ill patients. Definition: a critical aspect of care of acutely ill patients in the administration of intravenous fluids. Intravenous fluids may be required as a bolus infusion for restoration or as a continuous infusion when sufficient fluids cannot be ingested orally.
This is a short presentation explaining how the NICE guidance on intravenous fluid therapy will be implemented at the Great North Children's Hospital. We're going to first look at complications of inappropriate or unmonitored IV fluids. We're going to look how the guidelines try and reduce these complications, and we're going to explore how we plan to implement the guidelines. When poorly in hospital, children's electrolyte balance and fluid balance can be affected, and problems with abnormal electrolytes or problems with fluid overload and hypovolemia can be made worse by inappropriate or unmonitored IV fluids. Electrolytes of particular importance are potassium and sodium. There have been recent patient safety alerts because rapid changes in sodium have resulted in neurological injury and death in children, and inappropriate intravenous fluid therapy has contributed to these adverse events. The NICE guidelines state that for maintenance fluid, initially isotonic fluids, which in electrolyte composition most closely resemble normal human blood, should be used. Potassium should also be added routinely unless there's a contraindication, like renal failure. User needs should be monitored daily to guide fluid prescribing. However, for lots of reasons, children might need alternative fluid prescriptions. If this is the case, decisions will be led by the responsible medical team. Unless deemed clinically inappropriate, weight should be monitored daily and any changes noted. Fluid balance charts should be updated with running totals and also daily totals and overall fluid balance. As well as raising awareness through this video, we will also be adapting fluid charts to try and help keep within these guidelines. The new IV fluid prescription charts now contain an area where maintenance doses can be totaled, where alternative fluid plans can be justified if necessary, as well as the normal space to write a prescription. If rates of fluid administration or type of fluid is not in keeping with the guideline, for example fluids with different saline or potassium concentrations are used, the justification can be now clearly documented on these charts. In addition, fluid balance charts now have an extra section where weight can be recorded and compared to previous days to look for any differences or fluctuations in weight, and prompts to calculate daily fluid balance have been made clearer. In summary, 0.9% saline fluids should be first line, and fluid prescription charts should explain why this isn't the case in certain situations. Please ensure that weights and fluid balance totals are kept up to date and checked regularly. Applying the guidelines by using these interventions should help ensure the safety of children on intravenous fluid therapy at this hospital. Thanks very much for listening.
Applications in medicine. The goal of maintenance intravenous fluids is to preserve the extracellular volume while maintaining a normal electrolyte balance. Inappropriate maintenance fluids providing an adequate quantity of both water and electrolytes to ensure good tissue perfusion without causing complications related to fluid overload or volume depletion.
Dialysis works to remove excess waste, toxins, and fluid from your body. for chemically balanced blood and healthy amount of fluid. You can give your treatment a big boost and be your healthiest by limiting the amount of fluids you consume. Learning these fluid tips will help make your dialysis most effective and keep you feeling better. Shake off the salt. Managing your salt or sodium intake is important. Too much salt in your diet will make you feel thirstier. Choose foods with a percentage daily value of less than 10%. Avoid fluid traps, situations when you think you might just be drinking out of habit. If you're craving fluids, wait 10 minutes until the craving passes. Call someone or find another way to distract yourself. And when it's time to take your medications, try taking them with applesauce instead of a drink. Just chill. Find ways to keep yourself cool on hot days. Use a mist bottle with a fan attached. Wear loose-fitting clothing. And if you're outdoors, pick a shady spot. Foods can be fluids too, like popsicles, sorbet, ice cream, and watermelon. If it melts into a liquid, it's a fluid. Great snack choices to help quench your thirst include sugar-free gum and sugar-free hard candy. Also, frozen grapes, or freeze your favorite beverage in a bottle and sip as the fluid melts. Defeat dry mouth. Rinse your mouth or try using alcohol-free mouth spray. Remember, fluids are usually limited on a dialysis diet. Your care team will help you learn the exact amount of fluid you may have each day. So learn the fluid tips and stick to your prescribed treatment to feel your best. Visit freseniuskidneycare.com/fluid.
Pros: it prevents the development of hyponatremia or hypernatremia and other electrolyte imbalances. Cons: despite the almost ubiquitous need for intravenous fluids in acutely ill patients, there has been a little consensus in the most appropriate rate of administration and composition of intravenous fluids, and practice patterns with respect to maintaining fluids vary widely.
Hello, I'm Kendra from Dynatech Labs, and in this video, I'll be showing you our versatile and rugged fluid management system. At Dynatech, we've been using precise fluid dynamics to test medical devices for 35 years and have applied that experience to create a useful fluid management tool that can be used on all of our medical device testers as well as testers made by other manufacturers. Dynatech's FMS features dual flow loops that provide gentle heating to the testing fluid through a stainless steel shell and tube heat exchange system. The heating media passes through a sealed heater and then through a spiral tube housed within the main capacitance tank, providing gentle heat exchange. This approach eliminates excessively hot surfaces that can cause crystallization of PBS and decomposition of testing fluid. To begin the test loop, testing fluid is pressurized in the main capacitance tank and pumped at a variable rate through the proximal solenoid valve, and then through a submicron filter before entering the test system. When fluid returns from the test system, it's directed through a distal solenoid valve and then back to the main capacitance tank to complete the flow loop. The conveniently placed submicron filter is designed for easy replacement with sanitary flange fittings. Solenoid valves automatically close when flow stops in order to prevent unwanted draining of the test machine. Each flow loop features a valve installed at the lowest point for complete draining and cleaning. Thanks for watching. Contact us today to see how we can fill your medical device testing needs.
Issue applied in Ecuador. Acutely ill patients frequently have conditions that impair normal water and electrolyte homeostasis, and choosing the appropriate volume and composition of intravenous fluids required great care.
My name is Dilip Loba, and I'm Professor of Gastrointestinal Surgery at the University of Nottingham. For the next few minutes, I'm going to talk to you about perioperative fluid therapy. Fluid and electrolytes are probably the most commonly prescribed drug in hospital practice, and the provision of fluid and electrolytes is inseparable from that of nutrition. However, the knowledge and practice regarding fluid and electrolyte therapy has been poor, and this has often resulted in both an increased perioperative morbidity and mortality. Parenteral fluid therapy is usually prescribed to surgical patients who are unable to maintain an adequate oral intake. And it's important to realize the indications for parenteral fluid therapy. There are three broad indications, and they include resuscitation, maintenance, and replacement. For resuscitation, there is a deficit in the intravascular volume, and the main aim of fluid therapy is to fill the intravascular volume, maintain cardiac output, tissue perfusion, and oxygen delivery. Maintenance requirements are what most patients require, and that just amounts to the daily need of water and electrolytes, which amounts to between 25 and 35 mils per kg per day of water and 1 millimole per kg per day of sodium and potassium. Patients with intestinal fistulae are the typical examples of those who need replacement fluid therapy. And for these patients, you give them the baseline fluid therapy, the maintenance requirements, plus add like for what is being lost through the fistula. We must also remember that there is a dynamic interaction between the three indications for fluid therapy. For instance, a patient who has been adequately resuscitated moves over to maintenance requirement and no longer needs the large amount of fluid required for resuscitation. The aim of perioperative fluid therapy is to maintain a state of zero fluid balance, because both fluid overload and underhydration are equally harmful for surgical recovery. It has been shown in many studies that when patients get fluid overloaded by about 2.5 to 3 liters, they tend to develop edema, and edema causes increased complications and a prolonged hospital stay. Underhydration is equally harmful, and patients can have problems because of underperfusion of tissues, and so this should be avoided as well. So in summary, zero fluid balance is the key to good perioperative therapy. However, we must remember that sometimes fluid overload may be the inevitable consequence of the resuscitation process, and when these patients go to the post-resuscitation phase, we must try to get rid of the salt and water they have accumulated in the resuscitation phase. So, in summary, we need to give our patients the right amount of the right fluid at the right time. Thank you.
Conclusion. Intravenous fluids can be classified according to the concentration of sodium plus potassium in the fluids, as being either isotonic, approximately equal to the plasma sodium concentration, or hypotonic, less than the plasma sodium concentration. Thank you very much.